In the spine, there are several deep structures that can cause pain, particularly in the lumbar spine, can cause low back pain. These are the discs in between the bones of the spine, or in between the vertebral bodies or bones of the spine. The facet joints, which are small joints at the back of the spine, one on either side. They're a true synovial joint, just like your elbow or your knee. They have an articular cartilage. They have a joint capsule around them, and they have fluid inside of them for lubrication. They can become arthritic, just like your knee or any other joint. The third structure that can cause, typically called deep structure, that can cause pain in the low back is the sacroiliac joints. The two that were treated most commonly in pain practice are the facet joints and the disc. With the facet joints, each one of those has a small nerve that innervates it, called the medial branch of the dorsal lumbar nerve. It's easier just to call it a facet joint nerve, and so I will from this point forward. If you inject the nerve and numb up that nerve that is going to the joint, and you do it at several joints, all the joints that are involved radiographically by MRI or X-ray, and the patient's pain is relieved significantly by at least 50%, then if you could numb up that nerve longer term, they would have long-term relief. And there is a way to do that, and it's called radiofrequency neurolysis or radiofrequency neural ablation. It involves placing a small needle next to the nerve, passing a probe through it, a special probe that is hooked to a machine that generates a radio frequency signal. It's an electrical current, oscillating or alternating electrical current, at about 1 million cycles per second. It's the same technology that is used in electrocautery in surgery, although it's a much, much lower amplitude, not as strong. And it creates a heat lesion at 80 degrees centigrade that kills that segment of the nerve. Other tissue, surrounding tissue, is not as sensitive to temperature, and so we use that to our advantage to kill the segment of nerve and not injure other tissues. And that treatment will last approximately 6 months. The nice thing about it is that it does involve the use of steroid medications, it does involve surgery, it does involve the implantation of a device. You make the diagnosis with the injections, and if the pain recurs, you do the radiofrequency procedure, and that lasts for 6 months. If the pain recurs, then you don't have to go through the injection process again to prove it. You just go in and treat with the radiofrequency again. It's often used in conjunction with other therapies like bracing or topical treatments, physical therapy, of course, but it is a very important part of what we do. Radiofrequency denervation of particularly lumbar facet joints is very useful. In the cervical spine, you can have the same problem. You have facet joints there, and you can get pain, cervicalgia or pain in your neck. Plus, many patients will develop headaches, particularly occipital headaches, but they can spread forward and involve more of the head as well. They're called cervicogenic headaches. In fact, many migraine headache patients have a cervicogenic component. And we are referred migraine headache patients from a local neurologist because they are on optimum medical management and are still having migraine headaches of severity and frequency that is debilitating. They're missing work, they're going to the emergency room several times a week or several times a month, and of course that has its own risks, plus disruption of their sleep pattern. If you do diagnostic upper cervical facet nerve injections at the third occipital nerve, C3 and occasionally C4, and you get relief of the headache and neck pain, then they are also candidates for radiofrequency neuroablation or radiofrequency neurolysis. And then they can have 6 months of relief, perhaps not complete relief, perhaps not eliminating their migraine headaches, but at least making them more manageable, avoiding the frequent trip to the emergency room, avoiding the necessity to go in and get intravenous opioid narcotic pain medications, for example.